Amanda, can I turn to you to take us through your example here?
Sure. Thank you to my fellow panelists. We've talked a lot about partnership and collaboration, so I want to talk to you today about an innovative way of collaborating in the digital health space. So I'm going to talk to you about Digital Square. We are an innovative investment mechanism seeking to transform digital health systems. The project lives at Path, but has a consortium of over 40 partners and a growing consortium of donors. So we're multiple donors buying into this project. Digital Square focuses on strengthening digital health governance and advocacy at the global, regional, and country level. We do this through co-investment, support to global goods, and digital market readiness. And I'm going to talk to you today about global goods. This is my area of expertise. So the digital health ecosystem has been facing what we call this digital health systems disease of pilotitis. So the proliferation of these unsustainable small pilots and tools that have been deployed in countries and haven't been coordinated, haven't been scaled. And this has caused governments like the Ministry of Health in Uganda to issue a moratorium and say, stop piloting these projects. We're calling for implementers to coordinate your investments, to coordinate what you're doing, and to align what you're doing with our global health strategy or with our national health strategy. We want you to deploy systems that are scalable, that have already been implemented, that have a community behind them. And those are those systems that Digital Square supports. We call them global goods. They include IRIS, which is a health workforce information system. It's been deployed in over 20 countries. DHIS2, many of you are familiar with. It's a national HMIS deployed in over 60 countries. These tools have very strong communities. They have multiple donors. They are standards-based. They're set up to be interoperable with other systems, which is a very important point. They have been deployed and they have been scaled. This is just a snapshot of some of these interoperable digital health tools and technologies that Digital Square is supporting. How do we support these tools? And that's the innovation that I want to talk to you about. It's through an open proposal process, and I want to walk you through how this works. It's a very innovative, transformative way of calling for proposals and getting people to collaborate on proposals and collaborate on the need in the space. So what we do is we issue a notice, basically a call for applications, and we have a website, and we ask anyone who is responding to this notice to just put up a 3-page concept note, no more than 3 pages, showing their idea. It's on a site, it's transparent, everyone can see it. And this is the innovation. Normally when someone's has an idea and wants to pitch it to a donor, they hold it close to them. So what we're asking people to do and forcing people to do is put it up on a public space, and we have commenting. So people can comment on those proposals or those ideas, give feedback. Hey, I'm already doing this in this country. This isn't needed. Or, hey, we've been talking about this idea as well. Let's collaborate and go together on a consortium. So what we do is we have about a month for this concept note phase. Folks review each other's concept notes. We review them. The ones that are in scope go to a full proposal phase. Those, again, on this open platform, a full proposal, 15 pages max. Budgets are held private. We understand there's some sensitive information there. But when all of this ends, a peer review committee reviews all of the proposals that have been submitted. They give feedback to Digital Square on what they think of these proposals are showing. Should they be definitely recommended for funding, or it should be tweaked, or no, this is not kind of where this global good needs to go. These decisions or these recommendations are non-binding, and they are given to the governing board for Digital Square, who ultimately makes the decisions on funding for global goods. So I want to go back to this open proposal platform, because this is super new. This is the innovation. It's a virtual co-creation process. And we developed this platform, and we're constantly tweaking this platform for people to put their ideas up there. Anyone can go on this platform and give feedback, have open collaboration. You can follow the proposals. You can see the full proposal. We have information in there about use cases for the global good. We ask them to develop out use cases. We want them to put the code. Like, if this is open source, what's the code? Go ahead and put it up here. So it's all very open and transparent. We have some additional tools that we use to foster the review process. One is a global good maturity model. So a lot of these health systems and tools had no metrics to them on where they fall on this scale. So we developed this model, which looks at software maturity, global utility, and community support. So we ask everyone to do a self-assessment. Where do you think that your global good falls along this model? And it's part of the proposal process. Everyone must do it. If you fall lower on the model or score lower on the model, it's not a ding to you at all. It's just a metric to see where you are. And what we're doing with the proposals that or the programs we're supporting is doing a baseline, and then we'll do an end line to see if perhaps the support they received through Digital Square moved them along their maturity model. We're looking at a lot of maturity models in the health system space and in digital health in particular. So I think this aligns with a lot of what some of the larger thinking is in the digital health space. We also consulted the Boston Consulting Group, who helped us develop a prioritization framework. This framework is a framework to give us a way to look at the proposals and broke it down in scoring for 4 dimensions: impact, cost, technology, and probability of success. So this gives the governing board a little bit of structure in the way they're reviewing their proposals. The peer review committee I mentioned earlier is a diverse set of leaders and thinkers and stakeholders. They comment on the concept notes, they comment on the proposals, and then they review these proposals against that prioritization framework and give recommendations to the governing board. We have over 12 organizations on the peer review committee. It's purely volunteer, and this is growing. This is open to anyone to join. This is our governing board. We have 13 open chairs, 10 of which are filled. They are the ones that make the decisions for global good investments. This is just, I don't know if you'll be able to see, but an overview of the investments that we're funding to date through our notice cycles A and B, 7 through notice cycle A, 10 through notice cycle B. I have them labeled by the investor, the partner, the donor partner. We weren't saying donor yesterday. We were saying funding partner, and I really liked that. So the funding partners here. And I've also categorized them by the classifications for digital health interventions. A lot of this work is in interoperability and data exchange. The story here is in this chart here. So the first is just for our Notice B cycle, which ran this spring. The first graph shows the amount of funding submitted for request for funding through the proposals through this notice cycle, over $10 million. When the governing board reviewed all of the proposals, they actually approved funding for 20 of those 29 proposals that were submitted. So almost $8 million of funding was actually approved. So this is highly vetted, reviewed by many people. These are where investments need to go in this space. We only had a little over $1 million available through Digital Square for that funding. So that funding gap, that last line there, really shows the story of this is where the investment is needed. And it's very open and collaborative in that everyone can, donors can see, everyone can see this is what the proposals were, they weren't approved. Funding can come through Digital Square or go through another mechanism, but this is where the investments need to go. So how's it going? A lot of things are working well. This acceptance of transparency through this open proposal site I've seen be very transformative. At first, people were very reluctant to put their ideas up on a site so their competitors could see it. But I really believe they've been embracing this and enjoying getting feedback from everyone and seeing all of the ideas that are being put through. We're seeing a lot more engagement through this open proposal site, a lot of commenting, a lot of new ideas coming through. We're seeing an increased coordination on co-investment with a number of donors. So where you've got, through our Notice C cycle, which has ended and the awards will be announced the first week of December, GIZ invested funding through this notice cycle, particularly for Open IMIS, which is an insurance information system. And I think what's working well is we're seeing investments being made in a growing number of digital tools. A lot of times, global projects don't have enough funding for core investment of software, or bilateral projects have zero funding for core software development. So we're seeing this come through Digital Square. Our challenges, that big funding gap. We're constantly fundraising. We do our advocacy project, and we're really trying to raise funds to meet the needs for these global goods. Customizing that site, we're constantly doing that. We want to make sure that it meets everyone's needs, so we're making tweaks, updates to make things easier. We're also adapting best practices internally to manage this process. I'm not going to lie, it's a lot of work from a technical side, a contractual side, communications, partner management. It really is complex and a lot of work. And so we're applying tools and best practices to be as efficient as we can be. So the innovation continues. We're constantly improving on that platform and the process. We're partnering with implementers to augment support of those investments that we're already supporting. An example of this is providing a communications workshop to one of those partners that just transitioned from an organization holding the global good to a foundation holding the global good, or a community holding the global good. So giving some communications advice and a workshop for them on their messaging, how do they talk to donors, how do they talk to their participants. We're exploring opportunities for in-kind investments. So looking at is another organization, we've actually been talking with another organization who has developers that they might be able to lend to some of these health information systems, and so they can do some of the core development of the code for free, which is great. And we're expanding efforts to seek that co-investment. One story of co-investment that I just want to highlight is something we did through this last notice cycle B on Open CRVS, which is a civil registration and vital statistics platform. The proposal had, a bit of health component, but it was a lot of requesting support for the core investment of this civil registration platform. So we brought this up with DIAL, which is the Digital Impact Alliance, and they put in about $150,000 for this platform, and we put in about $70,000 for the health information systems piece. So this is a huge win, and looking at ways this process can foster this co-investment. So get involved. This is my call to action for everyone. If this is of interest to you, you can follow along on our open proposal site. Our next notice cycle will launch in mid to late January. Please join our peer review committee if you're interested. Come and see me. This is a really dynamic way to get involved and give feedback, which we very much appreciate on these proposals. And if you have funding for a proposal or two, we will absolutely love to talk to you about that. So thank you so much.
All right, thank you.